I just wanted to reintroduce ourselves. This is year number 2 for us now through Hunter's Hope. And so we're at UC Davis in Sacramento, California. And for those of you who'd like a little geography of where exactly it is, so you can see we're kind of in the northern part of California, although not the most northern. So we have patients coming from this area in our region, the northern area right by the Oregon border, the northeast area by the border of Oregon and Nevada, as well as the northwest corner between the near the Pacific Ocean and Oregon. So who we serve, basically, UC Davis serves about a 65,000 square mile area that includes 33 counties and about 6 million residents across Northern and Central California. The Children's Hospital resides within the main hospital, so we're not a freestanding hospital, so we're able to benefit from all the resources that exists. As you can see, we have about 121 beds for our Children's Hospital, 49 in the neonatal unit and 24 in the ICU, and as well as the cardiac intensive care units. And so we have more than 30 subspecialties in the pediatric division and department. There are more than 100,000 clinic visits, more than 6,200 hospital admissions, and nearly 11,000 emergency room visits per year. So we've grown and we've expanded since last year. So we have our team here, biochemical geneticist and associate program director, Maddie Martin, licensed and certified genetic counselor, Ayaka Suzuki, clinical care coordinator, Cassie Ingemanson, who's currently out on maternity leave, but clinical care coordinator, Karen Cleary, stepped up immensely and really got on board very, very quickly. Physical medicine and rehab, we have Dr. Arsenault. In pediatric pulmonary, we have Dr. Rory. Neuroradiology, Dr. Arzu Ozturk. Endocrinology, we have now 2, Dr. Armadi Modi and Dr. Carrie Schulmeister. And again, our extended team, we have movement disorders and adult neurologist, Dr. Josh Diananthan, neonatologist, Dr. Catherine Rotkamp, radiologist, backup radiologist, Dr. Matthew Babinski, ID specialist, Dr. Ritu Chima, volunteer administrative coordinator, Jordan Eisner, who is a MD candidate for the class of 2024, allergist immunologist, Dr. Victoria Dimitriadis, and also new addition, Dr. Cheryl Camarina, who's a licensed social worker, and she's been actually helping us out immensely with our social work issues. So again, once again about us, we see in the leukodystrophy clinic, our frequency now is about once per month. So it's a half a day per month. And so we're keeping up with the newborn screening protocols that have been in force for adrenal leukodystrophy since 2016 in California. And again, in the first 4 years, 355 babies screened positive. And of those, 41% determined to have an ABCD1 mutation of unknown significance. 95 of those males were confirmed XALD. And the state monitors closely for the manifestations of childhood ALD, and we're obviously one of them. Currently, we're treating and monitoring 7 patients who have screened positive. So treating specifically for the adrenal aspect, the adrenal insufficiency. Currently, something new is we're assembling a pediatric bone marrow transplant team, and interviews are in process. We have the nurse practitioners available. In the meantime, we continue to collaborate with UCSF when needed for pediatric bone marrow transplantation. And so currently we have about 5 MLD patients, 3 Aicardi-Gouttiere patients, 2 POL3 patients. The rest of the leukodystrophies are about 25 of them that we currently monitor and manage. And in March of this year, we transplanted our first ALSP adult patient who currently is stable with no signs of graft versus host disease. So we're certainly making advances. And again, we utilize telehealth as well to provide the leukodystrophy center that functions as a medical home for our patients, since they do come from a long distance. And again, we continue to benefit from the information and the data that we've collected several years ago. And we continue to collaborate with other leukodystrophy centers nationally as well as internationally. And we continue to be collaborating with the LCN regarding the epilepsies in leukodystrophies. And so once again, this is our website. We, as I said, continue to grow, so we're pretty happy with how things are going, and growing in terms of our patient population, our referrals, and growing in terms of our staff, our faculty and staff and support staff. So we're really pleased with how things are going. And if you know anybody in the area, please let us know. We have our website that's connected with the LCN. And then we have our email down here that we'll respond to. Okay, I think that's it. Well, thank you again very much for this opportunity, and I'll be online next week. Thanks. Bye.